And welcome back. Well, most parents are told very early on that all kids develop at a different pace. What works for one child might not be for your child. So how do you know if a behavior or condition is the sign of a problem or that your child is at risk for missing important milestones? The key is getting an expert evaluation and finding the right therapy or program that can help get your child back on track and up to speed. Jan Lawrence is a physical therapist with Curative New Berlin Therapies. She's here today with more on the latest and most effective treatments available. Thanks for being here.
Sure.
I love it. I think this is important to talk about is some of the types of developmental, orthopedic, neurological delays or conditions that a child might have that they would benefit from a therapy service like Curative.
Well, there can be a number of reasons that a child would have a developmental delay.
Mm-hmm.
Anything from prematurity, lower muscle tone, different syndromes such as Down syndrome, or some neurological conditions such as cerebral palsy or spina bifida. We also see children referred for conditions such as clumsiness or toe walking. And we also see a lot of babies who have a condition called torticollis.
And I'd never heard this word until you today. So let's talk a little bit about what that condition is.
Well, torticollis is a condition where an individual is unable to turn their head fully to each side.
Okay.
And they also might posture with kind of a head tilt. In babies, this can happen because of in utero positioning, or it also can happen after the child is born.
Okay.
Since 1992, it's been recommended that babies sleep on their backs, which has reduced SIDS, but it also has resulted in babies not spending much time on their tummies.
Yeah. And is that where they're learning to kind of lift and turn?
Yep, they get a lot of strength by doing that and by moving their head to both sides. There's also been a big increase in equipment that infants are placed in now,
yeah.
Swings and bouncy seats. They're not placed on the floor as much as they used to be.
Does that contribute?
It definitely contributes to torticollis, and it can also result in a flattening of the back of their heads because they have pressure on the back of their heads with all that equipment.
Yeah. So when somebody's diagnosed, say they're diagnosed with torticollis, you said during the break to me that they could be diagnosed as early as a couple months old.
Yes.
So when they do that, what kind of therapies do you use to treat it?
Well, first of all, we would ask if the parents see that their child is basically just turning to one direction all the time, that they discuss this with their doctor and get a referral. So then we would evaluate them. We would talk to the parents about different options for positioning to decrease that pressure on the back of their heads and place them in positions where they can just move around more. And we also would be instructing the parents in exercises to do to increase that flexibility and strength.
Yeah.
And we also include a lot of gross motor activities with the treatment so that they can make sure their child is keeping up with their milestones, such as rolling over to both sides, sitting, putting their feet in their mouth, all of that kind of things that normally children do.
What is it, if somebody doesn't treat torticollis, what are, I guess, some of the issues that could arise from that?
Well, they, like I said, tend to just look towards one side, so they might not be as aware of their other side. They might only put one thumb to their mouth. Yeah. They might just roll to one side. And then if they continue like that, their vision actually can be mapped so that their head is turned in a funny way, and so that they feel like that's normal for them. Yeah. So we want their heads to be in the midline as much as possible.
Yeah, I can imagine the early intervention is important with something like this, because the earlier you can correct it, the stronger both sides will be.
Yes, it's very important. We encourage parents to put their babies on their tummies as soon as they're born.
Yeah.
Like I said,
I hear all the time, tummy time.
Tummy time.
A lot of people hear tummy time.
It can be on the floor, it can be over the parent's lap, it can be on their chest. But all of that is important for the baby, again, to decrease that pressure on their head and to just move around and feel their bodies.
Yeah.
I am currently treating a 7-month-old who was referred about 3 months ago with all of those problems. He only rolled to one side, his head was tilted, and he couldn't fully look to either side. Yeah. So now he's able to hold his head in the middle, is rolling both ways. Parents have been very faithful with doing their home program, so it's really been a good outcome. A lot of research studies have shown that the earlier that you can get started, the better, the quicker the results, and the better the outcome.
What do you think makes Curative New Berlin with your therapies different from other places?
Well, I feel like we're a smaller clinic. We are very family-oriented, very friendly and caring. Our therapists are very experienced in a lot of different specialty areas. Continuing education has always been emphasized at our clinic, so we're up on the latest techniques.
I think that's wonderful. I know if I had a child, like, you'd be the exact type of person I would want to work with.
Oh,
I mean,
so nice.
You have that demeanor, you have that energy. So I want to make sure everybody has the information for Curative New Berlin Therapies. Here's where you can contact them at 262-782-9015 or curative.org/CNBT for more information as well for Curative Care New Berlin Therapies. Thanks so much for being here, Jan.
Okay, thank you. It's my pleasure.
Great. Appreciate it.